Hello and welcome to the channel Love Obstetrics and Gynaecology. Exercising is an essential element of a healthy lifestyle. In this video, I will guide you on how and what to advise your patient regarding exercising in pregnancy. First thing that pops in our mind is whether it is safe to exercise in pregnancy or not. Well, the answer to this question is both a yes and a no, depending upon the patient's risk factors. I would like to say a yes if she is a low risk pregnancy. What are those high risk factors? These high risk factors include a history of preterm birth, or she has in this pregnancy chances of a preterm labor. History of cervical cerclage. She is a case of preeclampsia or placenta previa, and some other medical disorders such as in heart and lung diseases that are associated with dyspnea, or she could be severely anemic. With these high risk factors, the risk benefit ratio changes and the patient is more prone for complications rather than getting a benefit from exercise. Coming on to the benefits of exercise, see, it includes reduction in the back pain, eases your constipation, improves the overall fitness, strengthens your heart and lung, and it reduces the incidence of gestational diabetes, gestational hypertension, excessive maternal weight gain. The incidence of low birth weight is also decreased, and cesarean birth. The cesarean birth incidences are decreased and you are more favorable for a vaginal delivery. The next question that comes in the mind is when to begin. You can begin exercising even prior to the conception or as early as in your first trimester. Next, how much should your patient actually exercise? For an already active and exercising woman, it is an easy task. For those patients that start exercising in pregnancy for the first time, it is essential they start in small bouts, let's say of 5 minutes. And those 5 minutes, they can do it like 5 minutes in the morning, 5 minutes in the afternoon, 5 minutes in the evening. And then gradually increase that duration of time from 5 to 10 minutes, and 30 minutes per day is more than enough. So your target is to set the patient for 150-minute moderate aerobic exercise over a week, and for that she will be required to do a 30-minute exercise daily, that is just for 5 days over a week. And you can also divide these 30 minutes into a 10 minutes interval. So now you know regarding the safety, when to begin, how much to exercise. But what about some safe exercising methods that you can advise your patient? Some of the methods include such as walking, stationary cycling, stretching exercises, dancing, and yoga. Some safe poses, prenatal yoga poses include butterfly pose, in which you are in a sitting position and it's good for your back. It eases your back pain, and also for the hips the joint mobility increases. The side stretch is in a upright position and good for your spine, balancing, thighs. Next comes the cat or the cow position. In this, basically the patient is in all four position, and it is good for your arms, shoulders, leg muscles, and basically you, as you exhale, you move your back towards the ceiling, and on inhalation come back to the neutral position. Also we have a child pose, and in this pose basically it is a relaxing pose in which you can inhale and exhale as you are resting. The tree pose is very good for your balancing, and it strengthens your spine and leg muscles. Also patient can go for the squat pose. The squat pose can be done with sport or without sport. Basically it's for opening up your hip joints, and it prepares you better for the vaginal delivery, and it should be performed basically in the third trimester or in the later half of a pregnancy. And this is because the patient has risk for landing up into a preterm labor. So basically advise your patient to go easy on yourself. Don't push beyond your limits. And if you ask me, are there any exercises that she needs to avoid? Yes, definitely she needs to avoid the contact sports, real hot yogas or excessive intense exercises, excessive intense runnings, skiing, scuba diving, and some stretching and yoga postures that require the patient to be supine, that is, lie on her back for a prolonged period of time, that needs to be avoided.
Last but not the least, but are there any possible complication associated with exercising?
The complications are less likely, but yes, they can occur. Complications can vary from patient to patient. The patient can have vaginal bleeding, leaking per vaginum, abdominal pain, or there can be onset of abdominal or uterine contractions. Patient can end up in a preterm labor, and the patient can also have other things such as headache, dizziness, dyspnea. And in all those conditions, it is better to visit a nearby health center or your gynecologist. So if you like my video, please do like, subscribe and share the channel Love Obstetrics and Gynecology. Thanks for watching.